Hi, my name is Mark Kay, and welcome to another episode of Psych Nurse. I thought that I'd sort of wing it today and try something new for a change. What I thought I'd do is I'd talk about mental illness and try and relate it to some movies. So, what I thought I would introduce is this book here. It's called Movies and Mental Illness. It's the third edition. It's been around for a little while now, but basically, the book itself. Uh, Points out all the movies that have been made in the past with a link to mental illness, and it also gives you like some case studies and things like that in there as well. Something that may interest you, and how you can evaluate, say, certain characters within the book as well. And there's all movies in there from Psycho to One Flew Over the Cuckoo's Nest to and they look at different types of orders, dissociative disorders. They look at depression. They look at psychosis. They look at mood disorders, they look at eating disorders, and lots of things like that. So, if it came to it and it was a fair depiction of, perhaps something that you're interested in, it's good to get that visual sort of backup as well, and to look and see how accurate their dictation of what mental illness is. And you can also look at the stereo sort of typical sort of side of things, and it gives you sort of case studies about certain characters, say Norman Bates, which I thought was quite interesting, looking at his assessment that's been done in the book itself, and it sort of gives you that sort of feeling to actually look at these certain characters in certain ways and maybe do your own assessment and see what come out with. It's kind of a fun way to look at mental health and learn how to do assessment, which is very important, obviously, being a scientist. So anyway, look, this video today will be a little bit chop and changey, and I'll see what I can put together and mash together today. If it doesn't come out great, that's okay. I'll just try again another day and maybe choose a different film. So anyway, this Alfred Hitchcock's Psycho, which is probably the first place I go. And some of the questions the book asks you allows you to sort of, once you've watched it, to evaluate it. So in this particular instance, the first question the book asks you is, once you've watched the movie, is that Psycho, the film Psycho, made by Alfred Hitchcock in the 1960s, it's regarded probably as one of the best movies ever made, ever. But does Alfred Hitchcock's idea of mental illness paint an accurate picture through the character of Norman Bates? So that's the first question. Yeah, the second question is a little bit more taxing, So, does the film Psycho do a disservice to people that have mental illness? Is it that stereotypical representation of a psychopath? Is that how people see people with psychopathy? And with mental illness, how does that fit in with the patients that you've probably worked with or heard about? Bates himself, when he's shown Marion around the hotel, he has a problem even saying the word bathroom. Is it true that people who have committed sexual crimes have issues with mature sexualized conversations or conversations around elimination? I guess we look at these things and we think, how often would you see a therapist treat someone with a dissociative disorder? And how often, would someone like Norman Bates come along in a lifetime? Marion herself, she's actually stolen $40,000 in the film, but Hitchcock kind of makes her this sympathetic character, how do you see her in the movie? How does a patient suppress the evidence of having a dissociative disorder, i.e. with his mother, she never replies to anything he says when he's talking to her. How does Alfred Hitchcock's story at the time fit in with the mood of what people thought about mental illness in the 1960s? How would you feel about working with someone like Norman Bates? Would you insist on security being there while you did your assessment? These are all things to think about, aren't they? He's a pretty scary character. if you know the story. But if you don't know the story, how do you feel about working with him and understanding, his capabilities? What is Norman Bates? Well, Norman Bates is a 27-year-old man who's been sent to you for an assessment by Madison Court County. They want a psychological assessment of him, and this is because has been accused of murdering his mother and his father some 30 years ago, and there have been two murders recently in the last 30 days. Norman's reaction to you coming to talk to him today. He says that he really was made to come along today, but he really believed that perhaps you, as a person that's going to do the assessment, will be able to help him, and he could truly get some help from you if he needed it. So today, when they look at Norman's history, or you look at Norman's history, you note that he has had some history of mental illness, in the sense of people have noted his eccentric type ways. He's isolative, he's secretive. There's lots of seclusive type behaviours, and but in saying that, he's never been known to be a risk to himself or others. I guess what else do they say is that he's never received any mental health treatment from a mental health organisation. When we look at Norman's medical history, he's had the normal childhood type illnesses, say chickenpox, measles, but he's never ever had any ongoing chronic type physical problems. He's never been hospitalised either, so from that point of view, he's been a pretty straightforward. Looking at Norman's developmental history, he was a young man that was reported to have reached his ordinary child milestones, walking and talking. However, he was socially isolative, and he didn't really recognise anybody as a childhood friend. He spent a lot of time at home and outside of school. He never mixed with anybody. He did actually drop out of school when he was 16, and he began to work at the Bates Motel. So the film demonstrates as well that Norman, whilst he was running the hotel, did the normal type things like do the books and general maintenance around the hotel. However, when the bypassed the Bates Motel, he became more isolative, and he's never been married, he's never had a girlfriend, he hasn't really had any strict social routine throughout his life so far. Norman will tell you that he doesn't drink or smoke, he's never used any drugs. In fact, he thinks alcohol is a sin. So when you see Norman and you're sitting face to face with him and the sheriff that's accompanying him, he's very well dressed. He's very articulately spoken. He agrees with all the process of the assessment, with the exception of avoiding and becoming non-cooperative with you when we start to talk about, or when you start to talk about his identity and what that means to him. Then things tend to go a little bit sour. Interestingly, when talking to Norman, he's orientated to time and place, but he's not orientated to person. In fact, he insists that he is actually his mother, and when challenged around this, he get quite irritable because even when you're pointing out the obvious, like he has male features, his mother was buried years ago. It wasn't until you start to talk to him a little bit more and just accept or acknowledge that he believes that he's his mother, that he starts to cooperate with the review again. But it's around his identity that things, as I say, tend to go a little bit pear-shaped. So looking at Norman's strengths from this assessment, you can see that he has an average intelligence. However, he has managed to cope by himself for a long, long time, and people have reported him to be quite friendly overall when they've visited the Bates Motel, and he's been quite successful at that. So that's a real strength for him. So the book gives Norman the diagnosis of a dissociative identification disorder. What do you think? So, because Norman's been ordered a forensic assessment by the courts, there is no treatment plan for him. He's likely to be locked up in jail for the rest of his life without any chance of parole. So I doubt very much the legal system or the mental health system will see any benefit in giving Norman any ongoing psychological help. And even if it was available, you're going to be looking at probably on a daily basis psychology for a number of years before Norman even realises who his real identity is. So from all of that, you can probably see that the prognosis is not very good for Norman, really. If he is found to be insane, he would probably be locked up in a state mental hospital in America at that particular time and probably spend the rest of his life there. He'd probably have extensive treatment, but it probably wouldn't help too much until Norman can turn it around and get some insight. And when I mean that, he hasn't got any insight at the moment at all. And for as long as he insists that he is his mother, it's pretty unlikely that that belief will be shifted to not believe that anymore. So the prognosis is not very good. So there you go. That's a little bit of fun with Norman Bates from the film Psycho, 1960. Alfred Hitchcock's famous movie, and has been and still is regarded as probably the best movie of all time. I would, if you haven't seen it, or you've only ever seen the shower scene on YouTube, take the time out to try and actually get a copy of it and watch it. It is a horror movie made from a different era, and it's a psychological thriller, I guess. Perhaps it doesn't have the panache of green screen and all the rest of it that's going on with it, but it is a very well-made film, and it's got some incredible scenes, particularly the shower scene. I'm not too sure how many different angles that shower scene was shot at, but it's got so many takes in just that scene, probably more in that scene than most movies that are made today. So, Alfred really does take his time and has a very interesting vision of this guy, Norman, and how he should be depicted on screen. So, check it out. Psycho, Alfred Hitchcock, 1960.